Good afternoon, and thank you very much for joining me today on the program, Healthy Living. My name is Adesuwa Osa Owagie. Often in time you hear people say, oh, that person suddenly developed a heart attack and died. Some other persons will say, oh, it was cardiac arrest. Some other person will say, oh, what happened to that person was myocardial infarction. And then we'll begin to wonder, what is it? Is it heart attack? Is it a problem with the heart? Is it one and the same? All three things we're talking about today. What is the common name for it? How can you know that a person is suffering from one condition or all three, if there is anything like that? So we want to set the record straight today, and we're going to talk to you about first aid when somebody is suffering from cardiac arrest. Often at times people suffer without even knowing what they are suffering from. And how to get help becomes a problem, most especially where there is no doctor or where a health facility is not in the immediate environment of where that person resides or wherever that condition occurred to the person. Or more so, the person may be traveling, it can just happen. It could be in the night when everybody is asleep and you can barely get help. So let's see what cardiac arrest means, when it occurs, how it occurs, cases, and how to prevent this condition. And then we will definitely get answers to all three: cardiac arrest, heart attack, and whatnot. We'll see how we can make sure you understand what we're talking about, so that when it happens, you will know what to do before you get to a doctor. So join me as I introduce to you somebody who is in the field. He is a health expert and, of course, first aid expert, and is here to help us out so that you will be comfortable, okay? His name is Ogenete Jiriwigo. It's nice to have you join us today. Okay, good to see you. Now, people talk about cardiac arrest. Others will tell you that it is heart attack. Some other persons will tell you that it is, the thing came sudden, myocardial infarction. So you keep wondering, are we talking about one and the same thing? That's one question. But the first one I would like you to answer is this: what is cardiac arrest?
Cardiac arrest is simply a condition where there's a problem with the electrical activity in the heart, and that affects the normal functioning of the heart. Mostly,
when you say electro activities, could you please break it down?
You know, the heart is a bundle of muscular fibers. Okay. And some of these muscular fibers are excited by electrical activity. So it means that they require some measure of electricity to function normally, to maintain the regular heart rhythm.
Okay.
Which is why
you're still not giving me the answer. When you keep saying electricity, somebody out there may say, oh, let me go and plug my heart to an outlet of electricity out there. So
okay, so basically the human body has some electrical charges.
Okay.
So it may not be the same as what we use in our homes to power appliances, but there is some measure of electricity in the body.
In the human body.
In the human body. So it is what helps some of these organs to function well, what you call biochemical signaling, all of those things. It is based on this electrical activity that they're able to function normally. So the heart is not exempted. The heart requires electricity to maintain its heart rhythm, and even as the heart is working, it also produces some electrical charges as well. So the pumping, the heartbeat itself is mostly is both the muscular and the electrical complement. So basically cardiac arrest happens when this electrical activity has a problem. So it is not the heart is not able to function normally because the rhythm is affected, or the electrical influence is affected, basically. So that is what we'll call cardiac arrest. And this will reflect when you do what you call an ECG in the hospital, electrocardiogram.
You must do that.
Yes, usually when you do that to monitor normal heart functioning. So it will measure electrical activity of the heart and be able to tell you if there are signs, because as I mentioned to you, as the heart is working, there's also this electrical footprint that it leaves behind. So from the electrocardiogram, which will present in graph, you can tell how things are working very well. So basically that is the long and short.
Okay, do you wait until you begin to feel some signs in the heart before you go to the hospital? Or anybody can just walk into the hospital and say, look, I need to do a test. I want to check my body.
You see, in ideal societies, an ECG is supposed to be a routine thing, something you do maybe once a year, to be sure, because as we grow older, we tend to have changes in our bodies that could predispose us to certain conditions, and sometimes to diet. So nobody exactly knows for sure, apart from maybe some peculiarities that exist, nobody knows for sure when health conditions will exist. So, which is why it's supposed to be a routine thing that you do, to be sure that you are still healthy. And if there are warning signs that exist that could tell, okay, this thing is about to go wrong, then ultimately your medical professional, your caregiver can begin to guide you, say, okay, avoid this and do that to prevent all of these conditions from becoming more set.
It's just unfortunate that a lot of us don't go to the hospitals. You're well, you're sound, you don't want to hear about the hospital.
They don't want
wait
to feel sick.
until one gets sick before you start running. Okay, now let's look at the other one, myocardial infarction. Is it one and the same?
Myocardial infarction is what we'll commonly call heart attack.
Okay.
So heart attack, myocardial infarction, same thing. However, it is slightly different from cardiac arrest in that for myocardial infarction, the problem there is more muscular. Okay. So as I mentioned to you earlier, there is the electromuscular input or a relationship that the heart functions with. So where in cardiac arrest, it is more the electrical component that is the problem. In the myocardial infarction, it is more the muscular. So you have more problems when you have blood supply shortage or blockage to the heart. So the heart, beyond pumping blood, also has its own blood supply. So the heart needs to get blood supply, oxygenated blood supply, to be able to pump blood to the rest of the body, because it's an organ like the rest of the body. So where you have an interruption, where you have maybe like blood clots and things of the sort that interfere with the blood supply to the heart, that is where you now have what you call myocardial infarction or heart attack.
Okay, because no matter what is going on with somebody's heart, you just hear heart attack, heart attack, heart attack, and you begin to wonder. The
reason for that is, to the layman, they present similarly.
Okay.
So to the person who is not trained, you may not know exactly what the difference is. So for most people, they just believe that myocardial infarction, as far as the person is holding the chest or complaining about chest pains, so it's most likely the same thing. And more medically, it takes a person who already has medical training to be able to distinguish that it is one and not the other. And sometimes even the medical professional would require some of these imaging or these tests to be able to identify exactly what is wrong with the patient and know exactly how to manage.
All right. Well, we want to look at it. What are the causes? What are the common causes of cardiac arrest?
There are a number of causes, and it may be difficult for me to exhaust all of them, but I'll focus on the common ones. First thing is if a person already has a pre-existing heart condition. Okay. So regardless of the kind of heart condition, as long as you already have a heart condition, which is why persons who have been diagnosed with conditions need to be closer to the hospital at that point to be able to monitor the progress they are making. And then they also need to be dedicated to their medications. For instance, I mentioned in myocardial infarction that blood clots could cause problems for them. So for every patient who already has maybe high blood pressure or a patient who already has certain other kind of conditions, they tend to put them on
diabetes.
Diabetes too, things that can predispose them. They already are put on medications that are meant to help their blood circulate properly, in theory. Okay. So the idea is, when maybe you're put on these medications and you don't follow them religiously or as prescribed, you then predispose yourself again by yourself to some of these other conditions, be it cardiac arrest or myocardial infarction. So it's important that people know their health status so that they can manage themselves accordingly. Then another thing that could predispose a person to any of these conditions could be age. As I mentioned earlier, the older we get, the more susceptible we are to conditions, because our bodies age, they're not as effective as they were before. So age is a predominant factor. So persons usually above 50, 60 begin to have increased risk of heart conditions. Then another thing that is a very, very common determinant.
Apart from aging, what about children? Sometimes you find children with heart conditions.
For the most part, these things are what we call congenital conditions. Congenital in the sense that some persons are born with heart conditions. It could be as a result of what we call teratology, maybe malformations while they were before they were born. So they probably did not develop properly, or some genetic influences too. So that is when they are now born with these conditions. Like we know the popular one that we told about the footballer who had a hole in the heart. So there are children who are equally born with these conditions. So those are different.
Okay.
So they may not be as commonplace or as normal as persons who progress to have heart conditions as they age.
But do children have cardiac arrest?
Well, it is possible for children to have, because as I mentioned to you, it is purely physiological. So if you have any of these physiological footprints or signatures that present or predispose you to this condition, definitely you can have a heart attack. That's why there is a course that is designed. It's called a Pediatric Advanced Life Support. So it's designed to assist in conditions of this case with children. And then again, there are conditions that a child could have that could predispose the child to, like you have infantile diabetes. Some children are born with diabetes, so that can already put them at risk of heart conditions and things of the sort.
All right, you're watching the program Healthy Living on Independent Television, and our call line is 052 290 573, 052 290 573. You need to call in to ask Tejeri what to do if you find yourself in such a condition. Now, let's look at this. Is it possible for one to survive cardiac arrest?
Yes, it's possible. However, it's a matter of statistics now, because for a locality like Nigeria, for the peculiarities that we have, for persons who already have these conditions or who are having cardiac arrest, time is of the essence, because with blood supply, a lot of things are going to be affected. The heart supplies blood to the whole of the body. So if the heart has a problem, it means the whole of the body has a problem. And predominant of that is the brain. For every minute that the brain spends without oxygen, oxygenated blood, after 4 minutes, the brain cells begin to die. Now they die to such an extent, they can die rather to such an extent where they have irreversible brain damage. So that is another risk that a person is presented with. So time is of the essence when a person has a heart condition. So if you are trained effectively, you know what to do, and you do it as you ought to, you can increase the chances of the person surviving. And that is why we always advocate that persons have first aid skill, because you never know when you need it. And everybody has maybe an elderly person, around them. And these persons, as we already mentioned, are persons who are at risk of this problem.
Before we go into first aid, I'd like to know what are the symptoms?
Okay.
How is one supposed to know that, oh, this thing is cardiac arrest, or I'm going to suffer a cardiac arrest? How is the person going to know? What are the symptoms?
Well,
what are the signs?
Very, very importantly, I would like to start with persons who already have pre-existing heart conditions.
Okay.
So when a person already has a history, when the person now presents with some of the symptoms I'm going to list, it's where you want to start from to be sure, because the person already has increased risk.
History,
And then again, there's another rule of thumb. It's always better to manage for the worst case scenario, because that way you cannot go wrong. Because it's either, if it's not as bad as that, then you would have managed for the worst possibility. So some of the things that could happen are chest pain, and for the most part,
severe, or just, sometimes you just feel this slight pain that says, oh, my chest, and then the person goes on.
Well, it's mild to severe. However, the more unique thing about the pain is it tends to radiate. Radiate in the sense that normally you'd expect that, okay, because your heart is here, you should feel the pain there. You may not necessarily feel it there. You may feel it there as well, but it may radiate all the way to maybe your left arm, to your back, maybe a little around your neck. So it just spreads like that. Because, yes, the reason why is there are major blood vessels that run from the heart in those directions. So for all of the areas that are now affected by their blood supplies are now affected.
So not necessarily just the heart?
No, it's not necessarily just the heart. So it could radiate like that, and that's one of the distinguishing features that okay, this is beyond maybe you are having just regular heartburn. And sometimes it could feel like a heartburn. So it depends on the person. So it's not a case of one size fits all, but we can estimate that from maybe a number of cases it will usually present in a certain form. So, but that's why I started with persons who already have pre-existing conditions. They are more at risk, and then persons who are older. So if you're already in the catchment area or persons who are already at risk, it is what we want to consider when you're already beginning to have chest pains. Then, added to the chest pains, things like fatigue can also come up, things like dizziness, and then something else that could happen is your breathing can be affected. You can have labored breathing. You can even, at some point, the person can go unconscious because your circulation and your breath, your respiration, they go together. Because you need the blood to carry the oxygen that you're breathing, and you need the oxygen to be in your blood for you to function normally as a human being. So when you have problems with your circulation, we want to be sure that you continue to have breath while we are trying to help you get enough circulation. So it goes together. So your breathing could also be affected. And of course, because you're not getting a lot of good blood supply, you will definitely get weak, which is what I mentioned earlier. And then another thing that could happen for persons who have some measure of training, you can check for pause. Okay. So when you feel for a pause, there's a chance that you may not feel what we call palpable pause. So when you touch, you may not feel it effectively. And then in some cases too, you may not even feel pause at all. So that's yet again another thing. And at the end of the day, the person can ultimately lose consciousness, which is what we try to guide against. And at such points, that when you get on the clock, because the longer the person stays in that state, especially when respiration is affected, that's an increased chance of the person dying. Yes.
All right, 052-290-573 is the number to call. Please call Tejiri. Ask him questions, especially if you know that a hospital or health facility is far from where you stay, and probably you have all the symptoms, all the signs, and you already have a heart condition. It might just happen anytime. Nobody's praying for it, but when it comes, how do you help yourself is what we're going to be looking into now. So ask questions so that you will be enlightened. No information is lost. You may think that, oh, you don't have the condition, nobody around you does have. You may just meet somebody on the way, and you'll be the only person that can help. So give us a call on 052-290-573. Now let's start like this. Often the time you will see people walk into a house and say, oh, the man was found dead, or the woman was found dead, and then the next thing was that, oh, it was a heart attack. If one is alone and you start feeling the symptoms, what is that person supposed to do?
Well, oftentimes, apart from what we are sold in mainstream media, in movies and all of that, we're told that we're made to believe that once it happens, the person is completely helpless, and the person just within a couple of seconds the person dies. It's not very true. Okay. Oftentimes, what happens is there may be time to call for help. There may be time to, if it were an area where you have emergency medical response, there would be enough time to activate that emergency response system or to call someone to assist you. However, that may not always be possible.
Okay. Let's quickly pick this call. Hello? 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 Hello, I can hear you. Can you reduce the audio level on your television set, please? Hello?
Hello?
Yeah, good afternoon. Good afternoon, I can hear you.
Good afternoon.
Please reduce the audio level on your television. All right, what's your name?
Hello? Hello?
Hello?
My name is Daniela. I'm calling from Ibadan.
Okay, nice to hear from you. Please ask your question.
I'm having chest pain on my left chest. It used to pain me.
Yes.
Yes, left chest pain. So I don't know what is it. It's like a sharp object, and it's painful. I'm just 21. I'm 21 years old. I've been feeling this pain since I'm 15 years old. So I'm scared.
You're scared?
Heart failure.
Okay.
I'm glad she can make the call. If she has been able to make that call, it means that there's enough time to get to a hospital for effective diagnosis. So what I would advise is that she gets to the hospital, because if there already is a condition, an existing condition,
Since she was 15,
Yes.
and now she's 21.
it means that over time she's just been managing, and which is what we're against. She should go to the hospital, they perform an ECG and probably an echocardiography, be sure that the heart is functioning normally, and then we can rule out that possibility. So I think that's the best advice I can give her, to go to the hospital for proper investigation.
All right, please go to the hospital, like Tijiri said, and see a doctor. You'll be fine. Hello, good afternoon. Yeah, tell us your name, please. Okay, Daniel, reduce the audio level on your television set, please. So you move away from your TV is. Okay, are we good? All right, Daniel, let's hear from you.
I didn't get the copies of cardiac arrest.
I can hear you, Daniel. Your audio level is high. All right, please call us. If you're calling in, kindly reduce the audio level on your television set, or you move away completely from where your TV set is so that we can hear you properly. Hello, good afternoon. Yeah, good afternoon.
Hello.
Hello, good afternoon. If you do not reduce the audio level on your TV set, there is no way we can hear you. All right, Tejiri, while you were talking, you talked about calling for help, emergency.
Yes.
That's one aspect of our society that is like gone into extinction or oblivion or whatever you want to call it. We do not have an emergency
System.
Well,
I'd like to think that that is gradually changing, and the reason why is essentially we have skeletal emergency systems in some areas, especially areas like Lagos and similarly. But it becomes difficult for me to say right now because it's not widespread that will overrule that.
Okay, let's take this. Hello, good afternoon. Hello, good afternoon. Hello? Hello? I can hear you. If you reduce the audio level on your TV set, then you'll be able to talk. Hello, good afternoon. Hello? All right, until you reduce the audio level on your television set or you move away completely from where your TV is, you will not be able to talk. Hello, good afternoon. Hello?
Hello.
Good afternoon.
Hello.
Hello, what's your name? What is your name, please?
Can you please send me the Joe's address? What
Okay, we'll talk about that later. All right, our number is 052290573. The number is on your screen. Please call in to ask Tejiri a question. Hello, good afternoon.
Good afternoon.
Yes, what's your name, please?
Huh?
What is your name?
My name is Derek.
Okay, go ahead, ask your question. Ask your question. All right, we lost that caller. Okay, we'll talk about calling for that. And you don't have, reduce the audio level on your television set, please. All right, so hello? 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 Good afternoon. Hello? I can hear you very well. Okay, that's nice. Thank you for calling. Please talk to us.
I'm having head pain.
You are having? Unfortunately, I can't hear you. The echo is too much. The echo is too much. Okay, just reduce the audio level on your television set when you're calling, and or you move away from that room where your TV set is completely, so that we can hear you and talk. Do we have another call? Hello? Okay, let's move on, Tejiri. Now, let's look at where a child is involved. what do we do to that child?
Because
most parents will panic.
Yes, yes. You see, for emergency response, it's very important for the responder to remain calm.
Okay, hello?
Hello? Good afternoon, ma'am.
Good afternoon.
My name is Comfort.
All right, Comfort, how are you?
I'm fine. I'm calling from Benin.
Okay, good. All right, talk to us.
I used to have back pain.
Back?
Yes.
Okay.
At the center of my back.
Okay.
And I have been taking drugs. They used to stop. And sometimes I used to massage the back.
Okay.
I don't know what else to do again.
Have you gone to the hospital, Comfort?
No.
You see?
But I used to carry these things like jerrycan, all those things.
Okay, Comfort, this is not rocket science. Go to the hospital and avoid carrying those heavy things, okay?
Okay.
Self-medication is dangerous. We do not support self-medication. We do not advocate it. Go to the hospital where you will find specialists. All right?
Okay, thank you.
Comfort, take care now.
Added to that, I think part of our problem may be how she's lifting.
Okay.
So that can also be a factor. But it's important to let our viewers know that they need to confirm, they need to go to a hospital where it can at least be verified or ascertain what is wrong before any treatment plan or regimen is prescribed. Otherwise, when you just think because you have pain somewhere, then
you run to
it will be very, very, very wrong.
Store.
Because at the end of the day, it may seem like a vehicle that is making some funny noises, and you say, let me just manage it, and ultimately it breaks down, and then you are left stranded.
The unfortunate thing is that most of us don't go to the hospitals until it is very,
it's too
late.
bad.
Now, let's look at a situation where a child is involved.
Yes, essentially, the interesting thing about managing cardiac arrest, there's a similarity between managing for adults and managing for children. And where the difference is, I would point out very quickly. The simple thing a person can do to assist another who has this...
firstly, how would you know the child is suffering from cardiac arrest?
Similar presentations as well, as we have mentioned. Now, but again, as I mentioned, the effective diagnosis is done in the hospital. So it's not on the ground. So what you can do as a lay person is to manage for the worst possibility. Now, oftentimes, these victims go unconscious. So as was rolling on the screen earlier, you'd notice some management techniques that we have always advocated. The first thing you want to do is what you call the doctor's ABC, or sometimes we add D, and there's a reason for that. You need to recognize the danger.
Okay.
Because all of what we're about to do now is cardiopulmonary resuscitation, but you need to first start with the dangers involved. So, first of all, if the person goes unconscious, you need to be sure if you're about to start management in an area that is safe for you as a responder, or then again, safe for...
Let me facilitate you. I hope you remember where you stopped. Hello, Kala, good afternoon. Hello? Hello?
Hello?
Good afternoon.
Hello?
Hello, I can hear you. Good afternoon.
Good afternoon.
Yes, please tell us your name and ask your question quickly.
I'm calling from Benin. My name is Sudan.
Okay.
Please, although it's not related to the topic cardiac arrest, I just wanted to find out what I should do about my mom who is complaining about internal heat. What do we do about that?
It's very simple. Go to the hospital. There are so many good hospitals in Benin. Go to UBTH, go to Central Hospital. You will find a doctor who will attend to your mom. Okay, so let's move on now.
So you need to be sure that the environment is safe for you as a responder first to manage. So that is a danger that you must address. So you have to, if you cannot take dangers away from the victim, you should take the victim away from the danger. And then you now have to do assessment. You want to check for response. Now, response is different for adults as it is for children. For children, most of the time, the response, we want to check for that at the foot. So you want to tickle the foot as much as possible because they are more sensitive there and it's easier for them to respond. As for adults, you want to tap them on the shoulders. You know, hello, hello. But you don't want to make the mistake of shaking them.
Okay, the person should not be...
Yes,
especially
if you meet the person unconscious, because you don't have the history, you don't know how the person became unconscious. So you want to tap and then talk to them, try to get response. If there's no response, that means the person is unconscious. Now, having done that, you want to call for help. That's why it's doctor's AB. So the S there is to call for help. So help could be if you are in an area where emergency response works, you can activate the emergency response service. If you're in an area where it doesn't work, you can want to call someone who probably has a vehicle that can convey you to the nearest hospital. So while you have done that, you can now progress into the ABCs. Now the A is for airway.
Okay.
As I mentioned to you, two things that are critical at this point is the circulation and the air, because they go together in making the person healthy or survive. So you want to open the airway of the victim. How do you want to do that? You do what we call the head tilt chin lift. So
the head
tilt.
Okay, head tilt.
Chin lift. Now, how that works is you put a hand at the forehead just like this, and you have your fingers, two of them, at the chin like this, and then you tilt it up, such that when you have done that, it makes the airway open.
Okay.
Now, when the airway is open, you are then very, very confident that the victim can have enough air supply. Now, when you have done that, the next thing you want to do is assessment for breathing. Now, how do you do that? For assessment for breathing, you do LLF. Look, listen, and feel. The reason why you do that is the easiest and layest way, if I may so say, to verify if the person is breathing. So while you have opened the airway, you want to be sure that the person is actually breathing. Now, how do you do that? You put your face very close to the face of the victim.
Okay.
Now, while you have opened the airway, you put the face of the victim very close.
Very close.
You put your cheek rather.
Okay, before that, let's demonstrate the first one again.
Okay, the LLF. So you put the hand here.
Yes.
And then you tilt two fingers like this.
Okay.
You tilt it up. So
okay,
the idea is...
the person is lying down.
Yes, lying down on the ground. The idea is this one keeps the head down so you don't lift it up.
Okay.
And then it's just the chin that you tilt, or you lift rather, such that it opens up like this.
Okay.
Without lifting the head off the ground. So that you can protect the person's vertebra and you don't cause further damage to the airway. Now, once you have done that, you can now come straight up to the breathing, which I mentioned is LLF. Look, listen, and feel. So you are looking at the person's chest for rise and fall. For a normal person who's breathing, you get to find out that the chest will rise and fall. So you're looking at that. You're listening for sounds of breathing. If the person is breathing, you should hear. And then you should also feel against the side of your face the air that the person is breathing out. Now, there are one of two possibilities. It's very possible that the person will not be breathing. It's possible that the person will be breathing. Now, if the person is breathing, we will be happy. And then you're already making arrangements to transport the person. So we are very sure. So that's LLF on the screen currently. So it's very, very easy. You're looking at the rise and fall of the chest. You're listening for the air, and you're feeling the air against your face. So if the person is breathing, you can make arrangements to transport to the hospital, and then you can do all of the hospital care that will be required, and then ascertain what went wrong with the person. So at the point of first aid, it is not for you in the house to determine what is wrong. You are supposed to just manage based on the presentation you have. Now, subsequent to that, it's also possible that the person will not be breathing, and that's where the risk is even higher. Now, for cases of where the person is not breathing, you now begin to do compression. You go into compression. Now, from compression, you get what you call cardiopulmonary resuscitation, which is what is most important. Now, how that works is, it is one part chest compression, is the other part artificial respiration. What that means is you manually get the heart to pump blood by pressing.
How hard?
Good. Now, you press at average of 4 centimeters deep.
How are we going to measure that when you're not in the health sector?
Well, essentially, that is why a person should get first aid training. Because once you have been trained, you would know exactly how deep your compression should go.
Let's not assume that a person is not trained and there's a situation like this.
Well, It becomes difficult for me to demonstrate right now because I don't have a mannequin here and I cannot compress on a live person. So, but essentially, you should press based on the placement of your hand. You see the heel of your hand here. You place that against the breastbone on the chest. Once you have placed it like that, I'm sure it will come on screen very shortly. You interlock your hands. The other one, like this. So while you are placed on the chest. Now, once you have placed it like that, kneeling very close to the victim, you put exactly, so that's about how it is. So you have interlocked your hand like that, kneeling very close to the victim. You ensure that you keep your elbows straight. So you don't move your elbows like you're grinding pepper on a stone. So once you have done that, once you put your weight on the victim, the extent to which it will compress naturally with that your body weight ought to be enough to compress the heart. But there's some discretionary element that you need to factor, which is the victim's size. If the person is bigger than you, obviously, there's a chance that you may not have as much weight to compress. So you need to compensate for the victim's body size. So if it's a small child too, you would not use your hand like this. You will use 2 fingers. Yes, just 2 fingers on the chest. So it is that simple. So once you have placed your hands like that, and we've already talked about the depth of compression, about an average of 4 centimeters, you should compress at a speed of 100 beats per minute, which means you should be fast enough to make an average of 2 beats per second. So if you can make that, it would mimic what is called the normal heart rhythm. So if the victim's problem were cardiac arrest, you would have compensated for that to some extent. If the victim's problem were myocardial infarction, you would also have compensated for that to some extent. So, but the CPR is not done at that point. You do 30 chest compressions. A cycle of CPR consists of 30 chest compressions and 2 rescue breaths. So which means that once I've done 30 chest compressions, I come back and do 2 rescue breaths. I breathe into the person's mouth. That's what you call mouth to mouth. You do that 2 times, you come back to 30 chest compressions again. So you continue to do that until either the victim recovers, you get tired, help comes, or any other factor, or it becomes unsafe for you to progress in that cycle.
What if that condition happened to the person while the person was sitting or driving or just walking?
And the truth of the matter is...
Because you just said that you don't move the person, you don't shake the person.
No. Let's be clear on that. To a very large extent, when a person gets into this condition, naturally they want to lie down. They want to get to the ground. So the only problem I will have is if the person were driving. Because it's going to affect the orientation of the person who is driving. So, but there are some persons who may be able to manage and get the car to a halt. And we hope for that every time. And then for others, well, we just hope for the best.
Driving.
We just pray that the person can get the car to halt. Thereafter, I'm sure, hopefully there will be bystanders or persons in the car too who can provide the needed assistance. Otherwise, well, your guess is as good as mine.
Okay, so now how do we prevent all of this from happening? Are there things you should do, things not to be done, food to be eaten, food to avoid to make sure this cardiac arrest does not happen?
Yes, essentially it comes down to healthy living. It comes down to healthy living. And the fact that you go to the hospital does not mean you're not healthy. It simply means that you're concerned about your health and you want to be healthy. So persons need to know their health status in advance, because if you know your health status, it becomes easier to manage.
Some persons will say, I don't want to know, because what you don't know don't hurt.
But unfortunately, if there are things that you just need to avoid and then you can go back to a healthy state, you wouldn't know if you don't go to the hospital. For instance, if your potassium level were very, very low, it puts you at risk of cardiac arrest as well. But a person would not know that if you did not go to the hospital to run a test.
It's not something you can just see with your eyes.
Exactly. So that is one of also the causes that I did not mention, because it's not always very common. So to a large extent too, you need to know the state of your health. You need to eat right. But again, how do you know what to eat right if you do not already know the state of your health? So it comes down to knowledge. So, and then exercise too is also very invaluable, because some persons may say, I don't have power to run, and then every day you are driving, as they say, AC car to AC office to AC house, and then no physical activity, just sedentary all the way. It becomes a problem. So, because the body needs some levels of exertion to be able to remain healthy. So, healthy lifestyle all the way. Eat healthy, live healthy, know your health status. I think these are the basic things that a person can do, because every other thing else, diet, exercise, avoiding this, medication, will depend solely on how healthy you are. So you must know that first before you can do anything.
So what kind
else.
of exercise do you recommend apart from running? Because it's not everybody that can run.
Definitely. I myself, I don't even like to run. But I think even for those who cannot run, you can jog. For those who cannot jog, you can walk. So I think maybe the person who runs 2 centimeters, so to speak, and the person who walks 4 centimeters, they have done similar amounts of work. So even when you cannot run, you can jog. Even when you cannot jog, you can walk. I think the idea is to break perspiration, to exert yourself. And then there are exercises you can even do on the spot. You can cycle. Okay. So when you do the idea is to exert yourself. In some of you can skip. So some of these things help to build your cardiac strength. Yeah, and it helps, even some persons, it helps them build muscle, and it aids your metabolism. So if you do some of these aerobics, I think you'll be better off for it.
Well, let's look at a married woman who does not have time for all of this. House chores, is it not enough?
Well,
because I have this friend that will say, no, I do enough house chores. I don't need exercise. I don't need to go to the stadium. I don't need to do any other thing.
The truth of the matter is,
house chores, I swear, that's just it.
House chores are not exactly exercises.
Really?
I don't think they are exercises. But even when you are busy, I remember those days growing up, my mother would wake up early in the morning and just jog through some of her daily activities that early in the morning. Okay. Just jog on the spot. And then, even if it's just for 10 minutes, and that could be enough for you to go on.
Now, how do we save our children from cardiac arrest?
For our children, I think it's important. The culture of you deliver at home, there's no need to go to the hospital, is very, very wrong. It's always good once a woman is pregnant, she should know to go and register for antenatal. Now, the idea is you know the health status of the mother, and then ultimately when she has given birth, you also know the health status of the child, such that if there's a need to follow up at certain other point, you should manage. So, and then self-medication for children is as bad as it is for adults, because a child may have this condition right now. You go to one shop, you buy this, and then the child seems to be well. But what you do not know is probably you have suppressed something that will present later on in life. So it's also good because hospitals have records. So if a child complains of this today, they flip through the records, they see that the child has had this before, then they can begin to speculate on what the possibilities are and all of those things. But when we lose all of these histories, and it becomes difficult for the person who wants to manage you now to make effective diagnosis. Because even in first aid too, we take history too. We ask questions. We want to be sure that we know some background information before we can make recommendations on what it is we want to do. So it's that simple. Ensure that we have a hospital culture, especially for your children too, because these are the children the ones who may not be able to give you the information because they do not know. So, and if you're not a medical personnel, you're not a trained life supporter, you do not have any of these skills, and you lose this information, it becomes difficult for the person who has never met you before to begin to fill in all the blanks.
So what kind of food can trigger cardiac arrest?
Well, it also depends on the health status of the person. Like I mentioned, if a person has low potassium...
Let's do it generally now. What kind of food?
For persons who are plus size, persons who are obese, you have what you call morbidly obese. Okay. If they begin to consume more fats, cholesterol and all of those things, it can affect their blood circulation. So that already puts a lot of things into perspective. So when you say eating right, you need to know your health status to know the sort of things you shouldn't eat. And then for persons who already have pre-existing heart conditions and you're taking a lot of caffeine or you are smoking a lot, those sort of lifestyle too can also put you at risk. You drink a lot of alcohol and you already have these conditions, it puts you at risk.
What about salt? Does salt have anything to do?
Well, the truth of the matter is Salt is important in the body, but it depends in the concentration. So depending on your health status too, depending on your chloride level, your sodium level, the persons in the hospital can decide to tell you, okay, lay off salt. Maybe your potassium, your sodium levels are too high, your calcium levels are too low, and they can help you titrate, so to speak, on how much salt you should be taking. Maybe they can tell you, okay, stay off salt, stay off sugar, stay off this for a while. But again, as I mentioned, if you don't go to the hospital, you don't run tests, nobody will know.
So the bottom line is go to the hospital.
Always go, have a hospital going
your
culture,
health
status. Yes.
Know where you stand.
Yes.
Health-wise.
Yes.
Do some exercise, and then you will be fit.
Yes.
All right, people, thank you very much for being part of us today. Tejiri, I'm so glad to have you on the show.
My pleasure.
All right, so if you want to live healthy, if you want to save yourself from cardiac arrest, heart attack, or whatever the name is, you must eat right. Stay away from smoking. Do not take too much alcohol. Okay, just a little will do. But if you know that you have a condition, a heart condition, then running away from all of this will do you a world of good. We'll see you again on Monday. Bye for now.